Hello, my name is Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. Do you know what frozen shoulder is? Do you or someone in your family have frozen shoulder and you're wondering what it is? Well, this video is going to answer that question for you. Frozen shoulder is also called adhesive capsulitis. It's a self-limited condition that resolves of its own accord, with most patients getting all of their range of motion back. There's a strong relationship with diabetes. There is no cure for it. However, we can treat the symptoms. Frozen shoulder is a condition that affects the capsule of the shoulder joint. All joints have capsules. We don't understand why frozen shoulder only affects the shoulder joint. It doesn't affect the hip or knee. Frozen shoulder is typically described as having three phases: a freezing, a frozen, and a thawing phase. The freezing phase is the initial phase. Patients start to become sore in their shoulder, and it often aches at night time. And if you put an arthroscope into the shoulder at that time, you'll see that the capsule of the shoulder joint, which is normally white and glistening, has become very injected with blood and is very red and angry. There's often a lot of synovitis within the joint. The condition then progresses, and that inflammation of the capsule causes the capsule to become thickened and stiff and contracted. It goes from maybe being 1 millimetre thick to often being 5 or 6 millimetres thick. And that tight capsule now stops the ball from moving within the socket, and the range of motion is lost in the shoulder. The range of motion tends to be lost in a global sense, in all directions. With time, the frozen shoulder resolves, and it goes from that frozen phase to a thawing phase, where the frozen shoulder gradually resolves and the range of motion returns as the capsule goes back to a normal-looking capsule. Frozen shoulder was originally thought to resolve in everyone completely. However, there are several studies over the last 20 or 30 years that have shown that this isn't the case. Schaffer et al. In the Journal of Bone and Joint Surgery published in 1992 a paper where they looked at a large number of patients. They followed patients for a period of 7 years, and they found that 60% of patients had at least some limitation in their range of motion. Hand and his co-authors published a paper in 2008 in the Journal of Shoulder and Elbow Surgery. They showed that at 4.5 years of follow-up, their large group of patients had not all resolved in terms of the range of motion. 41% had a mild limitation, and 6% had a severe limitation still present in their shoulder. Wong and his co-authors published a paper in 2017 in the Journal of Physiotherapy. This paper looked at all the available literature pertaining to frozen shoulder and the resolution of frozen shoulder. It was a meta-analysis of the available literature. And they concluded that the evidence clearly showed that not everyone achieved their full range of motion as the frozen shoulder resolved. Frozen shoulder commonly occurs spontaneously. Patients describe waking up with a sore shoulder that over time progressively becomes worse. It also commonly occurs after a trauma to the shoulder, and this can be mild or severe, and it also occurs as a complication of shoulder surgery. Frozen shoulder typically occurs in people aged between 40 and 60 years of age. It's much more common in women, at least twice as common in women, and there's a strong relationship with diabetes. The incidence of frozen shoulder in the normal population is 1 to 2%. However, in those patients that have diabetes, either type 1 or type 2, the occurrence of frozen shoulder is in the order of 10 to 20% of that population. The other thing to know is that 30% of patients develop frozen shoulder in the other shoulder as well and have a bilateral experience of frozen shoulder. In conclusion, frozen shoulder is a common condition that only affects the shoulder. It's a self-limited condition that resolves of its own accord, with at least half of patients getting all of their range of motion back. It's commonly associated with diabetes, and we don't have a cure for it. There's no treatment aimed specifically at the cause of frozen shoulder. However, we can treat the symptoms, and the symptoms are those of pain and stiffness. Thank you.